Okay, we are live, Chair.
Good morning, everybody, and welcome. It is Wednesday, January 19th, 2022. This is the weekly public meeting of the Lincoln County Board of Commissioners, which is being conducted virtually. I'm Chair Claire Hall and Vice Chair Katie Jacobson and Commissioner Doug Hunt are also present, constituting the full board and, of course, a quorum for doing business. First item on the agenda today is the adoption of our consent calendar. These are routine items or items that have been discussed at previous meetings. Do commissioners or staff have any items they wish to either highlight or remove from the consent calendar? If not, I would entertain a motion for approval of the consent calendar as published.
I make a motion that we adopt the consent calendar as presented.
I'll second it.
Okay, we have a motion and a second for approving the consent calendar. All in favor, please say aye.
Aye.
Aye. It's unanimous. I don't want to jinx things, but it seems like we've got a somewhat lighter than usual agenda today.
Don't say it.
Yeah, I know.
Come on, Chair Hall, you know better. Don't jinx us.
But no public hearing today. We don't have any decision or action items. We do have one discussion information item, and David Collier, our Human Resources Director, is joining us. We've got a memo in the packet about this proposal, but David, if you would just introduce it to us, and then we'll have some questions and discussion.
You bet. Thank you, Chair Hunt and Commissioners. So for the record, I'm David Collier. I'm the Human Resources Director for Lincoln County. So I did put a memo. I sent that to Commissioner or Chair Hall, requesting for a revision to our requisition process for identical position replacements. And basically at a recent management team meeting, we've had some discussions about streamlining the requisition process for these type of positions. And we put together a team to discuss that. That team included Public Works Director Roy Kenyon, Health and Human Services Director Jane Romero, Finance Director Christina Shear, IT Director Todd Richmond, Sheriff Landers, and assistants from Assistant Human Resources Director Jaylene Cook. And we met and discussed this a couple of weeks ago. And basically the current process for all positions is that the requisition originates in the requesting department, and then it goes to that department's director. It then goes to finance, and then to the to you three commissioners, and then to human resources to get posted. We have proposed that for identical position replacements, that the process be that the requisition originates in the requesting department, it goes to that department director, and then it comes directly to human resources for posting. And basically that eliminates forced signatures, which if any individuals are out of the office for a day and it kind of stacks up, I mean, it could delay the process for a week, sometimes even longer. And so I'm making this request to cut out some of the extra time that can delay that recruiting process. And with the difficulty of all employers are having attracting employees, I think that we should be doing everything that we can to make the process as efficient as possible. Again, since these are identical positions, we're keeping within the budget that's already been approved. And since our formal process has been to have both the finance and the commissioner sign off, I'm asking for your approval for the entire management team to amend this process. Any questions?
Questions from commissioners? Commissioner Hunt?
Well, I guess I have a suggestion. I'm fine with trying to expedite the process, but I also recognize that I think having a checkpoint, if you will, that is in the Board of Commissioners office has some value. And I would suggest that we add the county administrator as a sign-off authority after the department director before going to HR. I just think that it still is a significant reduction in the number of signatures that's required. It would be one individual. Generally, the county administrator, I think, would be available for signatures. And, you know, if that was still a challenge with the absence of the administrator, maybe there's something that could be put in place for the county chair or something. But I think there's value in at least having a review by somebody in the Board of Commissioners office, and I would suggest it be the county administrator.
I agree with Commissioner Hunt. I don't like completely skipping having the BOC involved in this. Just because someone leaves a position doesn't mean automatically that you get that position back. You know, things might have changed. There might be, there might be an opportunity to relook at how we do things. Anyways, I guess what I would say is we don't have a county administrator right now, to Commissioner Hunt's comments, and maybe at the time being it moves to the commissioner that is currently supervising that director. And then later on, when we do have a county administrator, that may be able to be substituted in. But I agree with Commissioner Hunt that I think there needs to be a touch point somewhere.
Well, I won't repeat what has already been said, just that I share the thoughts of my fellow commissioners. So, David, does that give you some direction on this?
Yes. So I can, would you like me to redo this and then bring it back next week? Would you like to just make that motion as far as making that adjustment? I can, we could do it that way, or I can also get the team that looked at this together and get their thoughts on that.
Yeah, let's, why don't you get the team back together, and if you can get a revised version of this proposal to us next week, that's fine. Or I know schedules tend to get busy. If it's the following week, that's okay too.
All right.
I'm fine with Commissioner Jacobson's suggestion.
Mm-hmm.
And I'm fine with Commissioner Hall's suggestion for, writing it back up and representing.
All right.
Agreed.
I will do that. Thank you.
Thank you, David. Now we move right along to reports and our COVID-19 and vaccination update from Public Health Director Florence Portal. Good morning, Florence.
Good morning, commissioners. Okay, so I changed the cover page of our presentation just to remind everybody of who is getting sick with COVID. I think this graph speaks for itself. Even though, as you can see, we're seeing an increase in breakthrough cases. This is a slide from the OHA breakthrough case report that dates January 13. It was just published yesterday. So as you can see, we're seeing an increase in cases, a dramatic increase in cases due to the Omicron variant surge. As you also can see, we're seeing a very, very steep increase in cases amongst the unvaccinated. And we are also seeing an increase in breakthrough cases. And it is absolutely not as dramatic as the increase in unvaccinated cases is. So I just wanted to start with this as a reminder of,
Okay.
yes.
Quick question, if I could. So this chart, just want to be very sure we all understand. This represents statewide numbers, not local.
Statewide numbers.
Mhm.
As you can see at the bottom left corner, I've put the source of the graph, so you can find it, and I'm happy to forward that to you all if you're interested. So you have kind of like the source of that graph. But yes, it's statewide.
Yeah, okay, thank you.
You're welcome. Casey, you can move to the next slide. Okay, so highlights for the week. The number of cases in our county I used exploding because yesterday when I made this, I was just like, well, this is a lot. So as of Monday, we were at 906 cases, and you will see I asked Callie to update as of yesterday, and we passed the 1,000 cases. We'll see that in a moment. So that's a lot of cases. As you know, this is only a picture of the cases that are being reported to us, meaning that if somebody tests at home and doesn't know or doesn't tell us that they tested positive, we will not have that case to be reporting on. So this is, I would say, the tip of the iceberg. I don't know how big is the iceberg, but I think there is an iceberg. Okay, so there is more than what we are able to see. So that's one. Second, you may or may not know, yesterday the White House has put a website together where we can all go in and order for free a kit that has 4 tests in it. It's pretty straightforward, very easy. It took me, like, I would say 1 minute to do it. Obviously, you need to have internet access. So if you do not have internet access, you can call the call center. And if you're willing to give the person who's going to answer the phone your mailing address and your name, we will be able to make that order for you. Once the order has been made, I think you can expect the test. I think what it says, it's between 7 and 12 days or something like this to arrive at your home. Also, our emergency management team put out yesterday a Lincoln Alert notice for all of us who have signed up into those Lincoln Alerts in the county. So that's that. Another piece of information is that the state had made this large order of test kits to be then distributed through community-based organizations, tribes, local public health authorities. We were notified yesterday that we could put our first order in. I don't know if we're going to be granted that amount, but I requested 3,000 test kits. We have been granted 7,000-ish test kits for Lincoln County. So those will have to be distributed to community members who are having a harder time to reach them. So we're defining our distribution method as we speak. But the library system of Lincoln County has reached out to us, so we'll definitely be working with them to make the kits available to people in our county. We also received a request from the food bank, and so I just need to reach back out and let them know that they could also be a distribution point. We are going to use our vaccination clinic also as a distribution site. So more to come on this, but this is what we're working on. Then those will be obviously distributed for free to people. And it's a test kit that has 2 tests in it. On the vaccination front, obviously the message we are getting out, and we're working on getting out there even more, is to get boosted. If you already got your primary series, please go get a booster if you're eligible for it, or get vaccinated if you're not yet vaccinated. As shown by the latest data, I know not everybody is a data oriented person, but it's very clear that COVID is now spreading way more within the unvaccinated population. A few key, I think, pointers. Omicron has been very good at adapting and evolving, and so it's been good at kind of like coming through the barrier of the original vaccination series, and it takes down the protection of those vaccines to 35%. But if you get boosted, then the protection goes back up for you. So it's very important for you to consider being boosted. There is, our 65 plus age category is doing a good job. We still would want more people to be vaccinated. We're about 65% of this population being boosted at this time, but we would want to get close to the 80%, and we would need that to happen for all age category. As a reminder, vaccination is not 100% protective, but it does protect you and your people from a severe manifestation of the disease, okay? It is really clear that even if you have a breakthrough infection, meaning you're getting an infection even though you got vaccinated, the disease is milder than if you were to get it and not be vaccinated or not be boosted. As a reminder, clinics are available without any appointments throughout the county. They are posted on our website. We've put flyers out, so you can call the call center to know when the next clinic is near your home. So I would really encourage people to do that. And we're really trying to make the vaccine as accessible as possible. And then just the last piece of information, if you're boosted and you are contact of a case, you would not have to quarantine. If you're not boosted or not vaccinated, you would have to undergo quarantine. So those are kind of like the main points that we will be pushing out soon.
Florence, before we move off of this slide, a question or two. I just saw a headline this morning that federal government, in addition to offering the test kits, is now also going to be offering N95 masks through apparently a similar distribution mechanism. And that seems to be good news as well. And here or at any point in the presentation, should we remind people about the recommendation to move to the N95s?
Yeah, so I didn't know of this latest info, so thank you for letting me know. Yes, so in terms of which mask is going to be more protective, so definitely with this variant, because it's so good at transmitting, obviously, if you're not wearing a mask, you're putting yourself at risk. If you're putting on a mask that is a cloth, you would possibly put yourself at risk. Obviously, it's going to protect you more than having no mask on, but it's not going to do a very good job anymore. Another option is to put a procedural mask on. that would do a better job than the cloth mask. And then the best option would be to put a N95 mask on, for sure. And I'll be sure to look for the information you discussed, and we can be sure to promote that as well.
Great, thank you.
You're welcome. Any other questions?
Yes.
Commissioner Jacobson, and then I think Commissioner Hunt.
Okay. Yeah, just a comment, I guess. I actually had a note yesterday from some leadership in the fishing industry asking if there was, a stockpile of tests for certain populations or for the public. And it sounds like we're on our way to having that once we actually receive the test kits that we've ordered. And, I think that this person made a nice point, was that obviously if you're out fishing and someone is symptomatic, there is no place to go and get a test in the ocean. So we may want to think about, working with them to get some tests distributed out to vessels so that they have those on their vessel and can test while they're there. And there's about 250 commercial fishing vessels in Lincoln County, so it's not necessarily a huge number. I'll send you an email, Florence, and connect you with the person that reached out, but just wanted to let you know that that was something somebody had asked about yesterday.
Okay, thank you.
Yeah,
Commissioner
Florence, this is Commissioner Hunt. Can you explain the parentheses on the last line under COVID cases? I'm not sure I'm interpreting it.
Okay, sorry. So yes, it means that the majority of the cases are amongst the unvaccinated individuals.
Right.
And for the week of January 2nd to January 8th,
Okay.
73.8% of the cases were amongst the unvaccinated.
Okay, I was reading that as 1/2 and 1/8.
I know, I can see now that it's strange the way.
Okay, well, your explanation makes total sense. Thank you.
Okay. Casey, do you mind moving to the next slide? Thanks. So those are stunning numbers, I just want to say. So those are weekend numbers from 114 to 117 statewide, and we had over 28,000 new cases in Oregon. We had to change the scale of this graph, right? Because now, as you can see, kind of the lowest numbers are around the 1,000 mark, and we're going past the 10,000 mark per day. So the curve might not seem as steep, but it is really steep. Next slide. Okay, hospitalization. So as as I guess forecasted, the hospitalizations are continuing to trend up, and it's not seeming to come down quite yet. So we are getting close to the 1,000 mark, and the projections by this modeling that was done by the Oregon Health and Science University projects a peak at about 1,600-ish hospitalization by the end of January. So I think it is fair to expect this curve to keep on climbing for hospitalizations. And one of the main messages really that I'm been reading from the Oregon Health Authority is, if you do not have an emergency, do not show up to the emergency department at the hospitals, and especially do not show up for a COVID test, or, please don't show up. Because that's straining the system even more. And we have plenty of options for testing in our community at this time, and more to come. And next slide, Casey. Thanks. So this is our local hospitalization data, updated as of yesterday. So as you can see, this is for North Lincoln Hospital. Definitely at capacity this past week for ICU beds. They had yesterday 3 patients positive with COVID in the hospital. I mean, they're handling their own, but you know, we want to keep watching those. Next slide. And so this is for PCH, and they're doing fine. They have currently 2 COVID patients in the hospital. So we have a total of 5 COVID positive patients in Lincoln County who are in the hospital at this time. Next slide. Okay, so this speaks for itself. We are mid-January and we had 1,043 cases as of this morning. You know, I mean, look at our case per 100,000. This is just unbelievable. 1,221 cases per 100,000 for the week of January 17. Way in the extreme risk category, just to use some former language. Test positivity rate is through the roof as well. So those are indicators that obviously COVID is circulating very well in Lincoln County. Next slide.
Florence, before we move off of that
Okay.
slide, I'd like to verify something in my memory, but tell me if I'm correct, that we've never had a month since the pandemic began where we've surpassed 1,000 cases, right?
Absolutely. And you can see it really, and if you're interested, I can ask our epidemiologist, Callie, to put this comparing slide back on the slide deck, to compare the 2020, 2021, and then 2022 numbers, so that you can really clearly see when we thought it was bad in 2020, then 2021 and Delta especially really showed us that we were not that bad, and now Omicron is.
Yeah, I think I would find that slide useful, and I imagine others would as well.
Okay, we can definitely do that.
Okay, thank you.
Yeah. Go ahead, Casey. Thanks. So this is the epi curve by week. So this is the amount of cases that are being reported to us on a weekly basis. Last week was 580 cases. This week, we're already at about 200 cases. So we're expecting this to obviously go back up. Next slide.
So while we're waiting, Florence, that last slide, that was information through yesterday, because I believe we had 100 cases or more yesterday.
This is information through...
It says the 16th, so...
so this is the beginning of the week.
Okay,
the 16th is
so
the beginning of the week.
Our numbers have probably doubled since then.
It's possible. And so this is what the vaccination rates that I was referring to earlier. As you can see, you want to look at the last kind of line, which is the percentage of booster doses. And we really need to get that higher because as you can see, we're still like pretty low. So I really want to encourage people to go get their booster as soon as they are eligible for those. You can go to the next slide. So as you know, we have those clinics that are recurring. So those are the clinics that we have Thunder Creek Community Club going on today, Lincoln City Community Center on the 22nd, where we're also going to have free testing there. Waldport Community Center on the 23rd, Ocean Spray Family Center on the 25th. And then we're working with some apartments to provide vaccination as well. The vaccination bus is at the Lincoln County Commons until tomorrow. So if you're around, they're open from 12 to 7. You can just walk in and go get vaccinated. They have all vaccines available from pediatrics to the variety of adult vaccines. Next slide.
So Florence, I'll show my ignorance. I know the Fistera Gardens is, I believe, in Yachats. Where's Fircrest Apartments?
Oh,
In
that's
Lincoln City?
that is a good question. I don't know. Let me check.
I could probably Google it.
Yeah.
It looks like it's in Newport. I just Googled.
Okay, thanks. You were faster.
It looks like it's Newport and run by the Housing Authority.
Yeah,
Okay,
that
and
would
we-
make sense.
Yeah, and we're also working with our partners in home health to make sure that the folks who are reaching out to us through the call center will get vaccinated. So this is underway. We're also working with the school districts to make sure that we have vaccination clinics that are going to be offered. I would like them to be offered prior to spring break, and then I would like another set of clinics offered prior to summer break. So this is in the works as well. And this is what I've got for you.
All right, thank you. Not reassuring news, but it is, I guess it's good to have the facts, and it's good to know that as well as we're doing, that if we get more people boosted, we get more people properly masked, that we can at least do something to fight this trend. And, I saw a national news article the other day talking about a worrisome trend. It said, and I think it was more anecdotal than anything of hard evidence, but suggesting it seems like more and more adults who are vaxxed and boosted are just acting as if they're done with the pandemic and engaging in risky behaviors that in many cases are leading to breakthrough infections. I know everybody, as we're closing in on 2 years, definitely has COVID fatigue, but I think the message we want to spread to people is in weekly presentations like yours, I hope are reinforcing it that no, we're not done with this yet.
Yes.
Any final comments from my colleagues? All right, Florence, thank you very much.
You're
And
welcome.
we'll talk to you next week,
Okay.
hopefully with better news, but who knows? We will
All right.
see. Commissioner reports. Do either of my colleagues have anything to share? Let's see. Commissioner Hunt's mic is on, so I'll.
No, I have nothing to report today.
Oh, okay. Commissioner Jacobson?
Yeah, so as everyone probably knows, we had a little tsunami warning earlier in the week. There's really nothing like getting a phone call at 5:30 in the morning and seeing it's your emergency manager that makes you jump up. Anyways, I just wanted to say, and maybe at some point we want to have Jenny come and debrief us about all of that, but one of the issues that came up again with this emergencies that has come up in the past, both with COVID and wildfires and flooding, is that the county doesn't own, and I don't know what they're called, but the things you would tow out and put on the highway, like the big reader boards, kind of like that ODOT has, that would say floods or chain up or whatever. I'm sure we've all seen them by the road. I've made requests for these for state funding previously and always been denied. And it came up again with tsunamis because it would have been a nice tool to put up to say, don't go to the beach or tsunami warning or whatever. And of course, trying to get the ones from ODOT in kind of a real emergency time, it just doesn't work. So it became, I think, obvious to everyone on the call, cooperators call, that we needed this tool again. And so Representative Gomberg had said that he will, again, take leadership and try to help us get funding for that. So as of today, I'm working with Director Kenyon. We got a price quote on how much those cost. I also reached out to Tillamook County, which is in Gomberg's jurisdiction, and asked if they needed any as well, and they do. So we are making a joint ask between Tillamook and Lincoln County for some of these trailers. We're asking for 4 for Lincoln County so that we can basically have them at different ends of the county, and then we wouldn't necessarily have to drive through an emergency to go and deploy them. We would actually have some in different parts of the county stored. So just an update on that, and hopefully this time we will be successful in getting funding for those.
Well, great news. Good luck. Keep us informed. I don't have anything to share today, so we move on to public comment. And Casey Miller, our Public Information Officer, is on the line. Do we have anybody signed up for live public comment through Zoom?
Okay, Claire, stand by. I do not see any live individuals, so please use that raise hand function if you do have comments you want to make. And so let's migrate to our smart sheet.
Okay.
And see what we have there. And in the interim of getting there, I would like to thank Commissioner Jacobson for showing up at the call center at 6:30 in the morning to help out with that.
I would like to thank Adam Shanks for bringing coffee and pastries at 6:30 in the morning to the call center.
Very helpful. So, Chair, we have no constituent input since the 12th, and you are looking at it. So I think without any hand raised functions right now, that probably puts a wrap on public input.
Okay, thank you very much. And the last thing I believe I need to do is remind everybody that the Board of Commissioners will participate in an office staff meeting virtually. That's at 9 o'clock next to Monday morning, the 24th. And then 1 week from today, same time, 10 o'clock Wednesday morning, the public business meeting of the Board of Commissioners commencing at 10 a.m. virtually. Until then, have a great week. Thanks.